right. Hey, everyone. Welcome back for another deep dive. If you're enjoying these conversations and finding them, useful, we'd really appreciate it if you hit that subscribe button. It helps us out a lot. So today we're going to be tackling something that I think anyone who's ever pushed themselves physically has probably wondered about at some point. We're talking about overtraining syndrome.
Yeah, absolutely. And we've got some really interesting information from the Cleveland Clinic to dive into. It really helps explain what happens when you push yourself too hard for too long. It's not just about feeling a little tired after a workout. This is a real medical condition with some pretty significant effects.
Yeah, for sure. It's easy to just dismiss that constant fatigue or those little aches and pains as part of the process, but overtraining syndrome, or OTS, is a whole other beast. It can affect your body, your mind, your emotions, the whole nine yards. So in this deep dive, we're going to unpack all of that. We'll look at the definition, how it can sneak up on you in stages, the surprising range of symptoms it can cause, what triggers it in the first place, who's most likely to experience it, what can happen if you ignore it, how doctors diagnose it, how to recover from it, and most importantly, how to avoid it altogether.
Never think a plan.
Our goal today is pretty straightforward. We want to give you a clear picture of OTS so you can recognize the warning signs early on and make sure you're training in a way that actually helps you achieve your long-term goals instead of, working against them. So first things first, what exactly is overtraining syndrome, according to the experts at the Cleveland Clinic?
Well, the Cleveland Clinic basically defines OTS as what happens when you're constantly pushing your body beyond its ability to recover. They emphasize that it results from extended periods of exercise that are either too frequent or too intense, and ultimately this leads to negative effects on your overall health. And, not surprisingly, they note that it's especially common among athletes who are really pushing their limits in training.
Right. It's like reaching that tipping point. You're pushing your body to get stronger faster. But if you don't give it the time it needs to repair and rebuild, it actually starts to break down instead. And I think the Cleveland Clinic outlines 3 distinct stages of OTS. Is that right?
Exactly. They do. And it's helpful to understand these stages. Think of it as a spectrum of how your body responds. The first stage is called functional overreaching, or sometimes functional overtraining. This is where you might see some slight decreases in performance or increased fatigue. Easy to brush off as just having a tough week.
Right, totally. Like, maybe I didn't sleep well or something.
Right. But the Cleveland Clinic stresses that this is actually your body's initial signal that it needs more rest. Like a little whisper saying, hey, let's take it easy for a bit.
So it's that feeling of your usual workout feeling a bit harder, or maybe your times are a little off, but you can still power through it.
Exactly. You might feel a bit more tired than usual, but after a day or two of rest, you're usually back to normal. But if you ignore those whispers, you can slip into stage 2, sympathetic overtraining syndrome. And this is where your body's stress response really kicks into high gear. Your sympathetic nervous system, that's your fight or flight system, goes into overdrive. And it's interesting, the Cleveland Clinic mentions that some doctors even call this base dose overtraining syndrome.
Okay, so those subtle hints are now more like full-blown alarms. What are some of the key signs that you've moved into stage 2?
Well, according to the Cleveland Clinic, in stage 2, you might start having trouble sleeping even when you're completely exhausted. That's the insomnia kicking in. And you might experience some pretty noticeable mood swings, feeling unusually irritable, agitated, restless, and physically, you might notice your heart racing even when you're just sitting around, and that's called tachycardia. You might even have elevated blood pressure. These are much stronger signs that your body is under a lot of stress.
Definitely sounds more serious than just post-workout soreness, and then things get even more intense in stage 3, right?
Yeah, stage 3 is parasympathetic overtraining syndrome, and this affects the other side of your nervous system, the parasympathetic system, which is responsible for calming things down, your rest and digest system. The Cleveland Clinic points out that this is often the most severe stage, and unfortunately, it can take a really long time to recover from. Some healthcare providers also call this Addison's overtraining syndrome.
And the symptoms here are almost the opposite of stage 2 in a way, right? Like instead of being all wired, you're just wiped out.
Yeah, exactly. Stage 3 can show up as this overwhelming, persistent fatigue that doesn't go away even with rest. You might lose all motivation to train, heck, even to do much of anything.
Yeah.
And you might even start experiencing symptoms of depression. And interestingly, instead of that rapid heartbeat, you might have bradycardia, which is a really slow heart rate. It's like your body has gone from being constantly revved up to completely shutting down.
And what I find fascinating is that the Cleveland Clinic points out that it's not always this neat, linear progression from one stage to the next. Your body might show signs from different stages at different times, depending on how it's reacting to the stress. Really highlights how complex OTS can be and why just focusing on one or two symptoms might not give you the whole picture. So this all sounds pretty serious. How common is overtraining syndrome? Is it something that mostly affects, like, elite athletes who are really pushing their absolute limits?
It's a good question. And it's easy to think this is something rare, that it only happens to top-level athletes. But the Cleveland Clinic cites some pretty striking statistics. They estimate that about two-thirds of elite runners will experience OTS at some point in their careers. That's a huge number. But it's not just them. They also mentioned that about one-third of all runners, regardless of their level, and roughly a third of competitive or high-level athletes across various sports are likely to experience OTS at some point. So it's definitely more widespread than many people realize.
Wow, those numbers are pretty eye-opening. So what actually triggers this whole process? What are the main causes of OTS?
Well, the most direct cause, as the Cleveland Clinic clearly states, is simply too much exercise. It's that natural drive to improve, to push harder, especially if you're competitive. But that no pain, no gain mentality can really backfire if it leads to constantly exceeding your body's capacity to recover.
Right. We're always told to push our limits, but it sounds like there's a point where pushing further just leads to diminishing returns and potentially even harm.
You got it. Overtraining can happen when you train too often without giving your body enough time to rebuild and recover between sessions. It can also be triggered by suddenly increasing your training intensity or volume without gradually adapting. The Cleveland Clinic gives the example of a runner who suddenly doubles their weekly mileage without any buildup, or someone who insists on long, intense workouts every single day, even when they're feeling run down.
So it's not just about the sheer amount of training, but the intensity and giving your body time to adjust to those increased demands. Now, are there certain people who are more likely to develop OTS? Are there certain risk factors that make some individuals more susceptible?
Yeah, the Cleveland Clinic points out that while anyone who's physically active can develop OTS, those who are training at a high level, whether they're competing or just trying to maintain elite performance, are definitely at higher risk. And this is especially true when they're ramping up their training load in preparation for an event.
Makes sense. The pressure to perform at a high level combined with intense training kind of creates the perfect storm.
Exactly. They also highlight that young athletes who specialize in a single sport from a young age are at increased risk. This could be due to the repetitive nature of their training, the pressure to excel, and maybe not having the same awareness of their body's limits as more experienced athletes. The Cleveland Clinic also mentions that a constant drive to be the absolute best and win at all costs in young athletes can contribute to this.
That's a really important point about youth sports. It really underlines the need for a more balanced approach that prioritizes well-being over constant pushing.
Absolutely. And they also note that certain types of sports seem to be more associated with OTS, particularly endurance-based activities where performance is often measured by races or time trials like running, swimming, and cycling. This might be because athletes in these sports are often tempted to constantly increase their mileage or intensity. Now, let's shift gears a bit. What happens if someone ignores the signs of OTS? What are some of the potential complications they might face down the road?
Yeah, that's a crucial question. If you just keep pushing through the pain, what are the consequences?
Well, according to the Cleveland Clinic, the most common complications of overtraining syndrome are actually sports injuries. When your body's in a state of chronic stress and hasn't had enough time to recover, you're much more susceptible to repetitive strain injuries, things like sprains, muscle strains, tendinitis, and even more serious problems like cartilage tears and general joint problems.
So that constant drive to improve can actually set you back because of injuries, pushing you further away from your goals. That's a really important takeaway. So how do doctors diagnose OTS? It's not a simple blood test, right? What does the process involve?
Diagnosing OTS typically involves a multifaceted approach. A healthcare provider will usually start with a thorough physical exam and a detailed discussion about your health history. They'll want to know about all your symptoms, when they started, what activities seem to make them better or worse.
I imagine they'll delve into your training habits and overall lifestyle as well, right?
For sure. They'll ask about your training schedule, especially if there have been any recent changes. They'll also want to understand your sleep patterns, your nutrition, any previous injuries, your mental and emotional well-being, even things like substance use. The Cleveland Clinic even mentions a kind of informal checklist that doctors might use, looking at things like a noticeable drop in performance despite getting enough rest, any mood changes or mental health symptoms you might be experiencing. And if your symptoms could be explained by some other medical condition or injury, it's really about ruling out other possibilities.
Makes sense. It's like putting together pieces of a puzzle, considering all the different ways OTS can present itself. Are there any specific tests they might use to help with the diagnosis?
The Cleveland Clinic emphasizes that there's no single test that can definitively diagnose OTS. It often involves what's called differential diagnosis, meaning your doctor will work to rule out other conditions that could be causing your symptoms before concluding it's OTS. But they might use several tests as part of this process. This could include blood tests to check your blood sugar levels and look for elevated levels of certain enzymes that can indicate muscle damage. Things like high levels of urea, uric acid, ammonia, or creatine kinase in your blood can sometimes be suggestive of OTS. Urine tests might be done to check your kidney function and look for signs of infection or other issues. They might also look for unusually high levels of cortisol in your urine, which can be a sign of chronic stress. And in some cases, they might even use pulmonary function tests or an electrocardiogram, an EKG, to check your heart function and rule out any heart problems. So it's really a combination of looking at your symptoms, your history, and using tests to exclude other potential causes.
So it's more about creating a complete picture, using all of this information, and eliminating other potential explanations. Once a diagnosis of OTS is made, what does the treatment typically involve?
The cornerstone of treatment for overtraining syndrome, according to the Cleveland Clinic, is rest. It's crucial to give your body enough time to recover. How much you need to reduce or completely stop training will depend on how severe your symptoms are. Your doctor will recommend a rest period that's tailored to how much OTS has impacted your body and performance.
It sounds like that could be tough for athletes who are used to being so active, but it's obviously essential.
It is. The Cleveland Clinic strongly advises against trying to push through or return to intense training too quickly. Light workouts might be okay in some cases, but it's important not to overdo it. Trying to ramp up your training again before you've fully recovered can actually undo any progress you've made and can even lead to chronic overtraining syndrome, which can be much harder to overcome.
So, listening to your body and following your doctor's advice is key. What about the mental and emotional effects of OTS? Is that addressed in the treatment plan?
Absolutely. The Cleveland Clinic points out that if you're experiencing significant mental or emotional symptoms, your provider might recommend talking to a mental health professional. Therapy can be really beneficial in managing those feelings and addressing any unhealthy coping mechanisms or thought patterns that might have developed as a result of OTS.
That's a good reminder that OTS isn't just about physical performance, it affects the whole person. Now, in terms of recovery, what kind of timeline are we looking at? How long can someone expect to be sidelined with OTS?
The recovery time can vary quite a bit depending on the individual and how severe their OTS is. The Cleveland Clinic notes that, in general, earlier stages might only require a few weeks of reduced activity, while more severe cases can unfortunately linger for months, or in some cases even longer.
Really emphasizes the importance of catching it early and preventing it from progressing. So the best strategy is to prevent OTS from happening in the first place. What are the key strategies for prevention?
The most effective way to prevent overtraining syndrome, according to the Cleveland Clinic, is to prioritize adequate rest and recovery between those intense workouts. It might seem obvious, but truly avoiding overtraining from the start is the best preventative medicine. They also emphasize being in tune with your body, recognizing those early warning signs of OTS, and not ignoring pain or other concerning symptoms. And if you're training for a specific event or goal, they highly recommend working with a qualified coach or trainer who can help you develop a well-structured training plan that includes appropriate rest periods and helps you reach your goals safely and effectively.
That makes a lot of sense. Having a smart plan with built-in recovery and expert guidance seems like a crucial safeguard. Finally, if someone is diagnosed with OTS, what can they expect in terms of getting back to their previous activity levels and their overall outlook?
The Cleveland Clinic advises that you should expect to significantly reduce the intensity of your physical activities during the recovery period. And if you have a more severe case, you might need to take a complete break from your sport or training for a while. They also point out that many athletes are often surprised by how long the recovery process can take, so it's really important to be patient and not rush things. It's important to have an honest conversation with your doctor about which activities are safe for you during recovery. Once you're cleared to gradually increase your training, it's wise to avoid jumping right back into your previous intensity. And keeping a detailed workout journal to track your performance and any new symptoms or changes can be really helpful in recognizing early warning signs and preventing future episodes of OTS.
Okay, so just to wrap things up, the big takeaway here is that overtraining syndrome is a real and serious medical condition that affects your physical, mental, and emotional health. It's definitely not just about feeling a little tired after a tough workout.
Exactly. We talked about those three stages: functional, sympathetic, and parasympathetic,
Yeah.
and how they can show up in different ways. From subtle dips in performance in stage 1 to more serious problems like sleep disturbances and mood changes in stage 2, and then that really intense fatigue and lack of motivation in stage 3.
Right, and it's so important to remember the wide range of symptoms, not just the physical ones. That no pain, no gain idea can actually be harmful here. OTS often develops from pushing too hard without enough rest or suddenly increasing your training intensity.
Absolutely. And we also learned that competitive athletes and young athletes who specialize early in a single sport, especially endurance sports like running, swimming, and cycling, are at greater risk. And if it's not addressed, OTS can lead to a whole bunch of frustrating sports injuries.
And we covered diagnosis, which involves a thorough review of your symptoms and history, a physical exam, and potentially some blood and urine tests to rule out other conditions. The primary treatment is rest and reducing your training, with recovery times varying depending on the severity. And of course, prevention really boils down to prioritizing enough rest and recovery, and maybe even seeking guidance from a coach or trainer.
So here's something to think about. Take a moment to really assess your own activity levels and recovery habits. Are you giving your body the time it needs to adapt and thrive? Or are you pushing yourself to the point of overtraining? Reflecting on this balance can really help ensure you can enjoy your activities and make progress over the long haul.
I think that's a great point to end on. Thanks for listening, everyone, and we'll see you in the next deep dive.